Okay, everybody, welcome to part 2. Thank you for being here. Oh, I forgot my light. Gotta turn my light on. Thank you for being patient and let me break this into 2 parts. I am done for the day, so I think my brain's firing even better right now. So this is a good time to finish part 2. So, yeah. Oh, you know what I also wanted to say about this backpack that I just got that I really like, and it's super colorful? It matches my phone. Like, how cute does this go with this? It just makes me really look forward to summer, right? Okay, so continuing from the first video, if you're here, we were talking about mitigating the effects of inflammatory side effects of certain viruses and people suffering from long haul COVID or damage from other illnesses or a bad reaction from certain injections and stuff like that. So we went over some natural things. I am not telling you to go out and take these things. This is just what I tell my patients to take because I know my patients. I know their medications, what they're on. So, you know, I'm just telling you so you can ask your doctor or practitioner, or you can read about it and do some research. So I am not telling you to do this. You want to run this by your own doctor if they are familiar with it. So we're going to continue then on that topic. So the next one we can talk about is turmeric, also known as curcumin. This one, as most of you, I know my viewers because they are smart and they're probably already taking this. I love turmeric. A good dose is 500 milligrams twice a day by mouth. The really cool thing is, besides bringing inflammation down, and it really helps with aches, pains, and joint pain, it does have anti-inflammatory properties, so really great for a brain on fire. If you've ever heard that term brain on fire, that's when people have literal inflammation in the brain, usually from particular viruses. Now, is that why some patients complain of brain fog after having COVID or certain herpes infections and what? Yeah, maybe. So I love turmeric because it's natural, it's safe, you can cook with it, anti-inflammatory and immunomodulating effects as well. It can help repolarize macrophages. These are a type of white blood cell that's part of your immune system response. Melatonin, that's another one. You know, the research after COVID was anywhere from 2 to 8 milligrams at night. And then the general would be 6 milligrams once before bed. I do like to start my patients out with 1 milligram because, yeah, I mean, it does help us stay asleep. Your brain naturally releases melatonin after 10 p.m. The sweet spot is between 10 p.m. and midnight. So night shift workers that are awake all night, they don't get the benefits of melatonin, which is like an antioxidant in the body and the brain. It's very protective. And so besides helping us get that good sleep, so when growth hormones released in the brain, that can help, you know, correct the damage that was done on muscles throughout the day. But melatonin does have a lot of anti-inflammatory and kind of cleaning up the cellular debris process. I'm explaining that very simply. That's not the exact mechanism, but love melatonin for that. So some patients can tolerate 3 milligrams and they can go from there. I myself am very sensitive to it. I do about 1 milligram. I don't do it every night. I just kind of do it as needed. And that way I don't shut down my brain's own production of it as well. I know for a while there, back when I was in school, they said Cancer Treatment Centers of America, which is a big hospital here, was giving their cancer patients 6 milligrams at night each night. So there you go. So kefir, that's a probiotic yogurt. You know, it's all about the microbiome in the gut now. You know, there's a lot of information out there how it can affect our emotions, our mood, our immune system. There's so much that goes with the bacteria that we have in our gut because there's good and then there's bad. So, you know, you want to provide some good probiotics to it. You can get that through kefir, probiotic yogurt, or even like a really good supplement with healthy probiotics in it. If you're on antibiotics, it's good to look for a probiotic supplement that has Saccharomyces in it because that's the one that fights Clostridium difficile, or we call it C. diff in the hospital. And so that's good to know. prebiotics are what feeds the good bacteria that you already have in the gut. So you can find that with certain foods like sauerkraut or fermented foods, but you can also get prebiotics in a supplement at the health food store. So people with leaky gut, dysbiosis, bad bugs tend to not get fermented foods. What's that one drink? Kombucha. I love that drink now. So that's like a prebiotic, feeds the good bacteria. But a dysbiosis or damage to the microbiome or the bad bugs has been seen in patients post-COVID or with long haul COVID. So there's a note about that. So a lot of people have heard of quercetin. Quercetin is naturally found in, isn't it onions and pineapple? I'd have to fact check that, but I believe it was onions and pineapple. But quercetin, or you can take something called a mixed flavonoid. The typical dose is anywhere around 250 milligrams a day in an over-the-counter supplement that you find at the health food store. So, and then the other one is called luteolin. That comes in about 100 to 200 milligrams a day. This has broad spectrum anti-inflammatory properties, so really great for brain fog and just immune support and bringing down inflammation. So those two in particular have been very helpful in treating neuroinflammation, so brain on fire. And then, again, I'm trying to stick with all the natural stuff before I talk about prescriptions. Let's see. I was telling my patients, again, you can't just run out and do this because I don't know what medications you take, but I was a big fan of baby aspirin there for a while because there was a lot of people having strokes, TIAs, which are ischemic attacks. Those are like mini strokes, blood clotting issues, blood clots throughout the body post-COVID or through certain injections. So I was telling my patients, if you're not on, like if they had any risk, like high blood pressure, overweight, diabetic, or whatnot, I was like, you need to be taking a baby aspirin chewable every day. But so keep that in mind as far as like talking to your doctor about. But okay, I do want to go over a couple prescriptions, which is really good to know about. So I'm I work in integrative medicine. That means I do standard medicine and I do natural medicine mixed together with my patients. And people that practice like me are very familiar with LDN or low-dose naltrexone. So traditionally, naltrexone is found in 50 to 100 milligrams, and it was to help patients get off opioids because it binds with those receptors and is really great when you're taking someone off of, Percocet, OxyContin. You want to get them on naltrexone to help them get off opioids. But it was discovered, and I'm sorry I forget the doctor's name that discovered, if you only give the patient a 0.5 milligram to 1 milligram to start, it actually has immune modulating effects, anti-inflammatory effects, and pain control. Naltrexone or low-dose naltrexone binds with the MU receptors in the body and really helps with pain modulation and pain control, which is really great. But there's actual anti-inflammatory effects with low-dose naltrexone as well. Now, if you ask your doctor about, hey, what's this about naltrexone? Can I try that? They're going to be, what? That comes in 50 to 100 milligrams. We don't give that to everybody. That's for those that are addicted to opioids. No, it's low-dose naltrexone. We're talking 1 milligram. I usually start patients on a 0.5 milligram. So because it's so interesting, and if you haven't heard about it, let's go into it a little bit more specifically. So I'm gonna, this is from the, here, let me see the name of this article, National Library of Medicine. The name of this article is The Use of Low-Dose Naltrexone as a Novel Anti-Inflammatory Treatment for Chronic Pain. And it's gonna go into treating anti-inflammatory things, chronic pain, fibromyalgia, glial cell modulator, and whatnot. So I like it with patients that have Hashimoto's, because that's hyperinflammatory state, SIBO, leaky gut, really any immune system affecting condition like rheumatoid arthritis, any of the rheumatoid conditions, really, when your body's immune system is attacking itself. Really great for that. So let's go through this, and I'm just going to pull out some of these. So here they're going to discuss LDN for treating chronic pain and inflammatory processes. LDN is a new class of therapeutic agents called glial cell modulators. We're going to discuss LDN as a monotherapy for chronic pain, but you can co-administer it with other pain medications. I don't do that. Okay, so let's look. Naltrexone, the original way it was intended, was synthesized in 1963 as a competitive opioid receptor antagonist, right? Okay, so it was approved by the FDA in 1984. And then LDN is, you're giving 1/10 the amount than the typical opioid addiction treatment dosage. Typical dosage can be 1 to 4 milligrams. Yada yada. I'm kind of skimming through this. I'm going to point out the important parts. LDN trials in humans first came out in 2007. That's why I've known about it for quite a while, but a lot of people are starting to find out about it now. So here they talk about treating fibromyalgia, which is, it's a chronic, if you don't know what fibromyalgia is, it's a chronic pain disorder that creates diffuse musculoskeletal pain and sensitivity to mechanical stimulation, as well as cognitive disruption, again, your brain fog, sleep difficulties, and just chronic fatigue syndrome, like a profound sense of fatigue. I was always taught that there could be 13 different trigger points on the body where you can identify fibromyalgia. More females tend to be diagnosed than males in this. Okay, and then they did a study with it. Okay, so I'm not going to go through that. I just kind of want to go through what LDN actually does. So let's move down to mechanism. Skimming through efficacy. Oh, here, let's look at the efficacy in inflammatory disorder. Again, I'm talking COVID damage, post-COVID, and injection damage. So here we go. Condition also treated was Crohn's disease. Now, Crohn's disease is an inflammatory bowel disease that affects the gastrointestinal tract and has systemic effects. LDN has been reported to reduce not only self-reported pain, but it brings down the markers of inflammation and brings down disease severity. So great to treat certain IBD diseases. Okay, let's talk about naltrexone and multiple sclerosis. So multiple sclerosis is an inflammatory demyelinating condition of the central nervous system, and there's evidence that LDN can help reduce spasticity and improve mental health and many clinical endpoints. So that's really cool. However, they did not have as much improvements in some of the study, but I think it shows promise in improving disease severity in those with MS. That's great. And then treating complex regional pain syndrome, known as CRPS. It's showing evidence of both local and low-level systemic inflammation, so that's great. So we might have hope there as well. Let's talk here an alternate explanation of the mechanism. So while we know that LDN works via novel anti-inflammatory channels, there's compelling explanatory models like this Dr. Zagon was looking into, that shows it prompts the body to compensate by upregulating both endogenous opioids and opioid receptors, and that the opioid upregulation effect of temporary naltrexone or the naloxone blockade has been demonstrated. So this opioid rebound effect could have multiple impacts on health and quality of life. That's cool. So why a low dosage? Successful treatment of chronic pain with naltrexone may require low dosages. Theoretically, a complete blockade of endogenous opioid systems is the desired effect. It may initially seem strange that a medication can have an opposite effect when given at such a low dosage. However, there is a strong precedent for this concept, and with opioid-related drugs in particular. So this was first widely reported in 1987 when they used to give low-dose morphine via IV. They did this in the animal model and showed great pain relief doing that. So there has been a model before of using medicine in the low-dose approach. I kind of always do that with medications anyway with my patients or supplements. I always say go low and slow. Even if the over-the-counter supplement says take 3 twice a day, I'm like, no, take 1 once a day. Go low and work up from that, because some people could be really sensitive to it. So in research studies, the typical dosage of low-dose naltrexone is 4.5 milligram. That is the average dose. Again, I give a 0.5 milligram to 1 milligram to my patients starting out. So the other interesting thing about low-dose naltrexone is the cost. It is not expensive at all. I think that's amazing. The average price, at least in the United States, is around $35 for a 1-month supply. Low side effects with that, no incidences of ulcers, kidney problems, interfering with most other common medications, no clotting risk, and it can also be used with many other medications. So what I'm trying to say is very safe. No withdrawal symptoms either when you're getting ready to get off it, or if I'm taking a patient off it, they don't need to wean off of it. And there is no known abuse potential. So great. Okay. So again, lots of information about low-dose naltrexone therapy. And again, this has been tried, at least with integrative doctors, in patients with long-haul COVID. Because I keep telling patients, I feel like COVID broke our brain. Or I have patients that have never had COVID. Maybe they got injections and it broke them. So I kind of like low-dose naltrexone. Again, I've used it for years for other reasons, but this is something else to think about if you're suffering from the after effects of COVID or the treatments for COVID. So there's other prescription medications. This is a long enough video. I'm not going to go through that now, but aren't you glad you stopped to look at my new backpack? Because I thought you need to have this information. I think it's good to have. So I think in next video, I'll talk about more prescription medications used to treat. By the way, COVID being a new virus, when I talk about low-dose naltrexone, this can be there for other, like cytomegalovirus. There's other viruses that have been around for a while that have caused inflammatory brain or brain on fire effects. And God knows there's labs in China and they're playing with other viruses that if it gets out of the lab, what was the article that just came out that they were, it was a coronavirus type virus they were using and it killed 100% of the mice. I'm like, good God, if that leaks out of the lab, we're doomed. But anyway, can't think that way. Okay, you guys, thanks for being here and I'll see you on the next one.